Becky Costello, manager of the Coleraine office. Becky, fill us in a little bit on what propelling to the next level is looking like around your office.
It's looking very well, very, very well. We did a lot of handouts and thinking things through and handing papers in, and I think it's a very good foundation.
Mm-hmm.
So then, right now we're doing the stars,
Mm-hmm.
and I don't think it'll last forever,
Mm-hmm.
but it's one of those things where they're getting a kick out of it,
Mm-hmm.
and most everybody's gotten a star for something,
Mm-hmm.
which is excellent. And I think at this point, the culture's established.
Good. Good.
So now it's just a matter of when you notice things going, not the correct way, maybe just saying something, tapping people on the shoulders, but the big part of it, I think, is done.
Good. Good.
Not that it's not going to always need some attention.
Sure. Nature of people.
Right.
Yeah.
Right.
Jessie did mention the stars. She
Mm-hmm.
said that she was really enjoying it.
Mm-hmm.
So it really seems like that seems to have caught a little fire,
Yes.
not only MAs to patients, but MAs to one another. Is
Right.
that true?
Oh yes, that's
Okay.
definitely true. And I think that that's in any place, any place. If you're working well as a team, it's going to spill over.
Okay. Okay.
And the thing that's so interesting about them reaching out to patients is it's so good for them.
Yes.
It's
Yeah.
so good for them.
Yeah.
And I don't
Jessica
think
kind of
they
talked
realize
about
that.
that two-way street of,
Mhm.
you get something good out of it, they get something good out of it, so it's a nice thing.
Right.
Good. Good. What do you see as Jessica's strengths during this period?
I think she has a great mind for seeing when somebody needs attention without them verbalizing it.
Okay.
She'll do things. One of the stories that I liked about Jessica, I was observing her. She had a patient trying out crutches
I see.
in the lobby, and she said, "You know what? Let me adjust those handles for you." And I thought that was above and beyond. I personally didn't even know the handles could be adjusted. I thought that it was all with the bottom of the, and I was like, wow. And she adjusted them, and the patient was like, oh, that's so much better. So I think that eye for noticing things that most people, myself included, may not have noticed, that even could have been improved. So
Okay.
that was a good one. Somebody comes in having a problem with their vision, she'll fill out the paperwork without even thinking about it.
Good.
It's just automatic. And always has been.
Okay.
A person looks like they might get sick, vomit, she's got the bucket right there.
Okay.
Whereas, a lot of times it takes a little gagging or a little coughing, 3 or 4 times before somebody will get them water.
Yes.
She notices them real quick.
Okay. So she just has a good eye, it sounds like. Good. Good. Okay. Good. Does Coleraine have any challenges left in particular that?
I do think that, like I mentioned about Jessica, all of us could notice things quicker.
Okay.
Without it being overtly notified that attention needs to be dealt out. Just, the more subtle things, I think, would be something to do. But I think that the willing to do it is there. But it can always be fine-tuned. And I think that watching Jessica, I think we've seen her do that. It's like, oh, this is good. We can do that.
Okay. So it sounds like the foundation is there. It sounds like people have been oriented to know what to look for. They just maybe need to pull the trigger a little bit faster.
Right.
Okay.
I think
Okay.
I agree. That's a good way of putting it.
Okay. Good. Well, it's good to know things are going well here at Coleraine. And hopefully everybody who's watching can take something useful away for their own office.
Oh, good. That
Thanks.
would be great. Thank you. Thank you very much.